Well, welcome everyone to tonight's session. This physician to physician session is CII CPAR right for you. So I'm Dr. Chris Lay. I'm a family physician at Ideal Medical Center, and I belong to Edmonton North PCN. And I'm joined today by my colleague, Dr. Sunny Oyama. And I'll just introduce him as a family physician at Gibbons Medical Clinic and at Summerwood Medical Center in Sherwood Park. And he's also the Sherwood Park Strathcona PCN board chair. We're also pleased to be joined by Dr. Janet Craig. She's from the Edmonton West PCN working at Glenora Medical Clinic, and she's the Edmonton Zone physician champion. And so she's been doing a lot of great work for our province and for our city in this regard.
Thanks, Chris.
So before we get started, I will walk through a few logistics and acknowledgements. So you understand and consent to the session being made publicly available via a link on the AMA ACTT website or any Edmonton Zone PCN website for an undetermined length of time. We would like to recognize that we are webcasting from and to many different parts of Alberta today. The province of Alberta is located on Treaty 6, Treaty 7, and Treaty 8 territory, and is a traditional meeting ground and home for many Indigenous people. So I'd like to introduce our chat monitors and facilitators this evening. We have Plaxi Madhu from Edmonton North, as well as Christina Vesti from Sherwood Park, Strathcona County. And they're both joining us to be able to help us out. We're also very pleased to be joined by the AMA Accelerating Change Transformation Team. Lots of people who help support this initiative, and they're on the meeting here as well to answer any questions and to provide any support that's needed. And as a disclosure, this program has not received any financial or any in-kind support. So I'm really glad that you're here today. Thanks for coming. What is the progress to date for this project that you're hearing about, CII CPAR? So this is a slide just to give us a sense of where things are as current to May 10th, 2021. And so in the entire province, there is been a goal that's been set to have 80% of physicians on with CII CPAR. And you can see where Edmonton is compared to the rest of the province. So one of the ways we're looking at is there's a lot of potential to grow. This actually shows where we are in the Edmonton zone. So just to unpack it a little bit, the light green are the people who are alive. The darker green are the people who are in progress, meaning that they've made a commitment of participation and things are in progress. Gray is just kind of determined from the people in each PCN who would be eligible to be part of it. So across the different zones in Edmonton, we have different opportunities to grow as well. So we do want to make the session helpful, and we are centering this around just the main questions that people are asking. Why CII CPAR? So just before I jump into that, I just want to give a little context of who I am, and so you just know a bit of where I've come from and why I think this is a really good program. So I grew up in Edmonton. I did my med school here. I actually was also part of the integrated community clerkship. So I was in Hinton in my third year. So I got a chance to see what it's like to be in rural family medicine. And so for my residency, I actually went to Dalhousie, and I was at one of their distributed sites in Moncton, New Brunswick, where I got to work in community family medicine. And after I finished residency, I moved to BC, and that's where I also did community and rural family medicine, where I was working in a variety of settings: inpatients, outpatients, emerge, surgical assists, walk-ins, everything. And so it just gave me a big breadth of, how to practice medicine, family medicine, really, as a generalist. And then eventually, my wife and I, we decided to move back to Edmonton, or home for me. And so I locum for a bit and then set up practice in June 2019, and been accepting patients since. And so that's what I've been doing. Yeah, and we'll go into the details because I'll be sharing some stories. Sunny will be sharing stories as well. But we'll just get a chance to talk about why we're part of CII CPAR. So the first thing I'd say is this is actually something that was requested by physicians. I know it sounds like there's just a lot of talk about it, but dating back to October 2016, there was an agreement that was made that, first off, the CPAR portion, which is being able to attach patients to their family doctors. That was something that was requested by family physicians. And then specialists also talked about, can we have a way of getting our consults onto Netcare? So that's the CII part. And so in the summer of 2018, all of this was combined into a joint thing. So that's why it's always like CII CPAR. And that's about this tool to be helping primary care and just being able to have continuity of care through the technology that we have here. Okay, so there's a lot of things, and I will try to talk through because I know there's a lot of moving parts and we hear a lot of systems that are in place. So I'll just try to explain where we're at in terms that I can understand. So we're all aware of Netcare. That's our provincial electronic health system record that collects from everything. And then AHS has decided to go to a common clinical information system. So all AHS facilities are going to move from ConnectCare. So they have 1,300 systems, and they're going to transform it all into one over the course of 3 years in 9 waves. So things are still moving along. So you can see with that arrow from ConnectCare feeds into Netcare. So information from the ConnectCare comes down that way. And then as you can see on the side there are the community EMRs. So those are the electronic medical records that exist outside of Netcare and outside of ConnectCare. And we're all just doing our thing, taking care of our patients and having information that's just in our little bubbles in where we're at. And there are some providers that are circled there, but we'll get to that. So right now, how things are set up is through ConnectCare, we have our e-delivery. That's the labs we see in our inbox, diagnostic imaging. So it has this one-way flow of information that just comes down as an electronic delivery into our electronic medical records. So that's what most people are familiar with so far. This is what we're trying to talk about. So this little half moon here is the Community Information Integration, or CII. Now, the reason why we have this is a data hub, which actually allows for two-way information flow between the conformed EMRs. So whereas before it's just one way from the top down, here there's an opportunity through the CII for these conformed EMRs to submit information up as well as receive things down. So that's really the cool thing that's there. And so part of that needs to happen is that there needs to be the Central Patient Attachment Registry, or CPAR. Now, the reason why that is because CPAR helps us identify who the primary care provider is for each of the patients. So rather than just sending information to every single person, if we are able to determine, hey, this is my patient on my confirmed panel, then through CII, information can go 2 ways. And so that actually enables one of the best things about this is the e-notifications, because there's now new things that are capable, that are patient specific, that can go from ConnectCare to Netcare and to us, basically to say, hey, here are some notifications that are things that are happening within the AHS system, namely any acute care interactions, and that actually comes to our inbox directly, which is great. Now, one of the things that people ask about, and so I'll mention it here, is there's also the healthcare data repository. That's something that allows for quality improvement and analytics to be gathered. And again, we've been assured that's all private, but that's just for systems level improvements. And this is all important because there's another big push that's happening, which is My Health Records. And so this is actually a portal where patients are able to access their own information. And so they're able to get things that come from Netcare. As you may have seen, over 95% of things are now available for patients there. And so the move is happening where things are going in that way. And so there's going to be all these connections between the patients, their health information, and all the work that we are doing as well. We'll continue on with this next slide. And I think just to kind of talk a bit about why this is important, because ultimately CPAR helps us identify the patients who are ours, and CII helps us to be part of the two-way flow. And this slide here is just to illustrate how the home to hospital to home guideline is actually really supported and worked through with CII CPAR. So if you look at that big check mark that says confirmation of primary care provider, that's where it starts. Because once you know, boom, this is my patient. Okay, that's great. And actually, one of the things that's going to happen is the CPAR confirmed physician will actually show up in Netcare. I mean, right now, who knows who puts it on? A unit clerk, a patient, whoever they find. If your name is similar to other people, it may or may not be you. But soon enough, we will be the ones who are actually confirming that this is our patient. So it starts there. And so as you see down, there's an admit notification. That's part of the e-notification that comes in. So that's actually great. Whereas before you kind of are told maybe someone's coming into the hospital, you actually get something right into your inbox to say, yep, this person is in hospital or they went to the emerge or something like that. But let's say they're admitted. And so when they're in the transition planning, they can actually look through. And if you're participating, there's one, the e-notifications, but two, there's the consults from the specialists from the community, as well as something called the CED, which is the Community Encounter Digest, which we'll talk about soon. But that's actually the notes that you are submitting up into Netcare, say, hey, this is what I've been doing for my patient. And that actually helps people within the hospital in the acute care setting take care of our patients. And so as they're getting ready for the discharge, they can take together all the consults and the reports, and then just kind of figure out who are the people to be connected. So you're not just dependent on like the on-call nephrologist or whatever. You can actually re-refer them to the person, or even just pick up the phone because you now know you're not depending on someone remembering or just kind of guessing through it. And then so as patients are ready to go home, boom, we get an e-notification. They're discharged on this day from this time from this thing. And then that gives us, again, something that lands into our inbox that says, all right, my patient's discharged. I should probably call them in and have a chat with them. I know I just blew through that. So we'll just continue on with the questions that people have. So what about privacy? This is probably the biggest thing people are wondering. I don't want the government looking at what I do. And so what is being done to protect physician privacy? So first of all, information is confidential. So the thing is, when within the EMRs, only the things that are mapped are the things that are going to go up. It's not like there's this like weird kind of connection where it's going to suck everything up. Only the things that you have identified or the EMRs have identified, they will go there. And if things are confidential within your patient encounter, just don't put it into something that's going to go up, as easy as that. But even on top of that, each EMR has the ability, there's the ability for the EMRs to have confidentiality features to mark it as confidential. So if it's marked confidential, it doesn't go up. And then even more, if there are patients who are really concerned about their information, they can even ask that to be masked or obscured. So that's something for you to know. And then another question is, well, what about my patients? How will they know? So this CII CPAR project actually runs under the Alberta Netcare umbrella. So it's already covered by the Health Information Act. So we just need to post a health collection guide, and that's it. You don't have to talk to them directly, but there are scripts and things to provide support if wanted. Right. And then this is that point that there's EMR confidentiality or record masking on Netcare available for you as the provider and for the patients if there's anything that you think is sensitive that shouldn't go up. But ultimately, you're the clinician. You choose what goes up. Nothing has to go up unless you choose to. Well, all right. So we've heard all this. What do the reports look like? So we'll jump into that next. So this is just like kind of the big picture look of the Community Encounter Digest. So after you have mapped things out, so you can see if we look at the top right corner there, so a community encounter. So that's kind of the blurbs that I usually write in, like this is what I saw them for, UTI gave macrobid, whatever, and or no worrisome signs gave macrobid, boom. So that's something I just say, so at least that's there. And then there are other things that are mapped that can go up too. So there are past medical history, possible allergies, any observations. So that's like vitals and things like that. And then referrals. So that's something that is available just to see kind of if you kind of follow through the map system, then we can see, oh, here's where the referrals are going, at least what's submitted. And so for the community encounter portion, that is a rolling 12-month collection, so a digest. So it only just kind of summarizes it. It's not just there forever. It's just to say, in the last 12 months, what's been going on with their primary care provider. Whereas for the referrals, those actually will stay on for 3 years. So there's a bit more continuity, especially, sometimes patients will be seen by consultants early on, then every year or so. Having that extra time helps to just have more information, really for us to know, to get a glimpse on one page, what's been going on with their health history outside of the acute care setting. So when you're going to Netcare, if you look on the side, it'll have this community reports, and if you just click down, it has the Community Encounter Digest, or the CED. So, because I'm one of the early people and I do try to check to make sure things look good. So, or at least that they're there. So that would be something that a person can see just to see what's been going on as a summary. As far as consults, it falls under the consults letter as well, or header as well. And so people who are enabled with CII CPAR can upload their consults. And if you're a family physician who does consults, you can also enable that option as well. But this is a chance for people who are in community who do consult letters. They can actually go onto Netcare so other people can see it. So it's not just hidden away in a PDF in your own EMR. Other people can access this too. And then the other thing, and really I think probably is the best thing about this, is the e-notifications. So this is a screenshot of what it looks like in HealthQuest. So I just you get a little blurb says INR, CBC, da, da, da. So you just get things like this. So what you actually get really from e-notifications are really their encounters with acute care. So for example, if they're in the emerge, if they left the emerge without being seen, if they were in the emerge and then were admitted, if they're discharged from hospital, and if they have day surgery. And so those are the types of notifications that come. To me, honestly, it's nice that I get it as an electronic notification in my inbox rather than having to get a fax that's scanned, have to look at and do something. It's just there. And, how burdensome is it? Well, I think it really depends, on how big your patient panel is and how sick everyone is. But as far as the day-to-day flow, this comes in along with the rest of your labs twice a day, one at 6 a.m. and one at 2 p.m. So I think it's reasonable. I try to stay on top of my inbox and just kind of hit it as it is. And I have automated workflows with my staff so they know, hey, if I have this is what we got to do. And so you can make it move fairly smoothly so it's not too onerous. If anything, it just gives you really quick, very close information to how your patients are doing. Here's an example of what it will look like. So if you click on it, it'll give you a summary of what happened in the emerge or in the hospital, whatever information was decided to be put in, variable quality, but at least you have something. And actually one of the things that they changed recently was also if a patient is deceased, that also gets indicated as well. But it's really nice that we see the demographics, where they've been, what time, who the admitting or attending provider is, and any of the other quick notes that happened there. So that's been, so this is now live for HealthQuest, Wolf, MedAccess, PS Suite. Accuro is coming, I believe, as I understand. Okay, so I know I just gave a lot of information about kind of the nuts and bolts about CII, CPAR. So really, what's in it for the doctors? So I'm really glad to be joined by Sunny to be able to share some of the stories. So I'm actually going to hand it over to him and he's going to share some stories.
Thank you very much, Chris, for that beautiful presentation there. Welcome everybody. And I'll just tell you a little bit about myself. I'm a family physician. I run two offices, two practices, one in Gibbons, which is a small town, northeast of Edmonton. And the second is in Sherwood Park. So understandably, I have patients from a variety of places, patients from Morinville, patients from Bonaccord, patients from Brotherham, and then patients from Edmonton and so on. So obviously my patients, just like every other physician's patients, go to different places to receive care. And sometimes you just don't know where they've been to. You just do not know at all where they've been to. I mean, because patients have the right to go anywhere. And sometimes it's after hours and all of that. So that was actually what drove me, into CII CPAR. And I can tell you right off the bat that CII CPAR is basically teamwork. You're never, ever doing this alone at all. Like you can see on the screen there, the team comprises the clinic manager, the physician, the PCN practice facilitator and panel manager. Justin is here, he's mine. The e-health consultant, the AMA Act consultants. These folks are just available and they do all the work for you. And I would like to just say time is not exactly my friend. So if this was going to be like a complicated thing to sign up to, if it was going to be complicated for me to sign up, I wouldn't have touched it at all. But it was done like so almost seamlessly for me. And all I did was just do some paperwork here and there, sign a few documents here and there. But the team did virtually, everything, the PCN, the AMA, the e-health consultant, the practice manager did everything. And like you can see the quote there from Roseanne, who is my clinic manager, who happens to have the same last name as myself there. She thought it was going to be a challenge. It was going to be difficult signing up to CII, CPAR, but with the help of folks from the AMA, Amira, Jason, the AMA, and everybody, it was done very easily. It was no biggie at all. So overall, there isn't much of physician work involved. There's a lot of support that is available. ACT is always in the background, to support you. Clinic managers play a very important role in using the reports once we've gone live, and we'll continue to be able to reach out to a PCN to support quality improvement. So we know that the family physicians know their patients best. Like nobody knows your patients more than you, the family physician. And so the onus is actually on you, on us, the family physicians, to know about everything that there is to know about our patients. It's just one of those things that we don't have much choice over, that we have to know exactly what's happening with our patients. So, and that's why CII CPAR means a lot to me, because it enables me, to enhance the quality of care I provide my patients. I know where they've been to. I know, where medications have been changed. I know when new medications have been started. I know what sort of investigations that have been offered, initiated, and all of that. And e-notification is just great. I mean, before I signed up to CII CPAR, if I needed to know anything about my patients, I had to log on to Netcare and then, go search to see, okay, what was prescribed, what was not prescribed. And even at that, the information there, the information on Netcare is not complete, if you want to put it that way. But with CII CPAR, especially with the e-notification functionality, it has just been great. So my little story. Before signing up to CII CPAR, I had kind of hinted at that it was more like after the fact, you got notification, you got those little emergency room notes, handwritten, most of them, and some of which many of us would struggle to read. And I kind of wonder, when I was doing ER work myself, how people were struggling to read my writing there, but with the e-notification, it's all electronic, so it's, you're receiving typed documents, so it's all very clear. So before I signed up to CII CPAR, I got a call from the medical examiner's office, and they wanted information on a 42-year-old patient of mine who was found unresponsive at home and passed away in the hospital. So you can imagine, as a family physician, how thrown away you would be, just being told that, and the medical examiner is asking you questions. Okay, what's this guy's history like? What kind of conditions has he had in the past? Did you have any suspicion of anything? And when you have a patient base as decent as mine, it is almost impossible to know everything about your patient. You'll know some things about some patients, but it's so difficult to know everything about every patient, So then I had to oh, can you hold on for a second? Let me log on to my, let me pull up the patient's chart, look up his records, and no, and all of that. So I felt kind of inadequate in that sense, that I didn't have all the information I needed to have at the fingertips to provide to the medical examiner. Now, after signing up to CII CPAR, which I did, some 2 or so weeks ago, I automatically will receive an e-notification. So I would know exactly that such a thing had happened. And it's so sad that I'm using the example of somebody who is diseased, because this also applies to just about every other situation, where somebody will question you about, or somebody would like to know about details of your patients, So with signing up to CII CPAR, I'm like more proactive. I would have been able to, in this particular instance, just to use it for our discussion here, in this particular instance, I would have been able to connect with the family. I mean, a 42-year-old man suddenly passing away, no family physician would like that to happen to any of his patients. So I would have been able to connect with a family, and I would have been able to review his chart even ahead of time. Like Chris mentioned earlier on, these notifications come at 6 and 2 p.m. I would have been able to review his chart, have some information on hand, to provide to the medical examiner or anybody else who would be asking for that information. And then we also are living in the COVID era, where, of course, our patients go to different places, get tested and get assessed and all of that. So without CII CPAR, you just don't know where your patient has been to. I mean, like, you basically cannot start going through your patient's charts and going on Netcare to see, okay, who did, no, but with e-notifications, boom, it's like, boom, borrowing that from Chris, boom, it's there in your inbox. So you get notified, you have peace of mind, which is so very important. I mean, family practice on its own is stressful enough, but where you have to second guess and think about other things too, that adds to the stress. So that takes away the extra stress, and which is just so very, very important, to me. Being able to know everything that is happening to my patients, and being able to provide whatever information that is required about them. Good, Chris, I'll just hand that over to you to continue.
Great, thanks, Sunny. Yeah, and so thanks for sharing your stories. And I think we have different ways of just kind of highlighting some of the things that's benefited for us. Like for me, because of my past experience working in different clinical settings, especially in acute care, emerge, walk-in, inpatient and stuff, it just really has helped me think about how I want to be a family physician and how I would work in primary care as an outpatient. And so I think, that's just one of the ways that we do it. So where my clinic is located, it's in, it's close-ish to downtown, inner city. And so, the patient population I have, just by virtue of where I'm located, low SES, mental health issues, substance use. And so that's just the nature of things. And, people in that situation also need good primary care as well. And so I'm just doing what I can to make sure I can advocate for my patients by making sure they have good, information so that, that's there for them. But then on top of that, I also have an increasingly Vietnamese speaking population whose command of English varies. And so if I can at least provide a bit of notes as a family doctor, as a person who's getting to know them, that gives us a chance to go up. One of the stories I do like to share is one of the things that we do at our clinic is we work with Palmakers Lodge, which is a residential treatment facility for patients who are looking to treat their substance use disorder. And so, for patients in this situation, my heart goes out to them because they're motivated to get on the right path and to be able to abstain from these substances. And so in the encounters we have, I just try to spend a bit of extra time to make sure I collect a bit more of the information, and then I just put it into my note so it can go up into Netcare. So who knows what happens, and I just want the best for them because it's a chance for me to help them. And then one situation here is there's a patient that I'd followed along with for a while she was in Palmakers, and then eventually she wanted to be my patient, and we were working along together to titrate her meds, and and that was nice. So I was just uploading all the stuff, any tweaks that we did, and then eventually her situation changed, and so she moved to rural Alberta. And so I mean, obviously I couldn't see her, and she was presenting to different facilities throughout the province. But, there were a couple of occasions where people called me to say, hey, what's going on? What's your situation like? What are your thoughts on this? And so, as the person who was, identified as her primary care physician, at least I can help with the team that was dealing with her in hospital just to get some insights there. Yeah, so for me, I really like CII CPAR because it helps me advocate for my patients. That two-way flow means that I can actually contribute as their family physician, as their primary care provider, up into Netcare, which is where a lot of people are looking for stuff. So for my Vietnamese speaking population, that they just get seen, they get heard. If anything, that they had a physician who has assessed it and kind of seen them. So my colleagues in the Emerge and my colleagues in the hospitals can at least see, okay, what's going on. And so that's how it's one of the ways to connect. And the primary care provider will be shown in Netcare. I know we had said June there, but I think it's still, they're in the last little stages of their tweaks, but eventually I will be the one that's listed as their family doctor because there's another doctor in Leduc who has a name that's very similar to mine. So I get some of his things, he gets some of my things. And so I don't get all that stuff because someone else was just like, oh, is this Christopher Lee? And so eventually I will be able to one to say, I'm their doctor, please send the stuff to me so I can take care of my patients. And the last thing here too is the e-notifications, like today is actually just even a live example. I had a patient over the weekend who presented to the Emerge twice, one for an acute situation, and the second one, because while he was being wheeled out in his wheelchair at home, he fell and then had to go to the Emerge again, and he was on warfarin. So, for me coming in on a Monday, like, oh, here are two things I got to do. So I try to make sure, because as a family doc, I mean, one of our forever questions is, are we having timely access for the patients who need it? I think e-notifications give us a hint and a clue and a support towards that. So like, these are the people who are sick. Here are the people who were just discharged. Here are the people who were seen for these things. Here's a chance for me to make sure I make time for them. So those are some of the ways that I feel that this helps my more vulnerable and more sick patients to be able to get the best care as they can, with me as a family doctor giving information to our colleagues who are also taking care of them. All right, so we've said a lot of things between Sunny and me. So we're actually going to go into our live Q&A session now. So we're open to questions, and it's great that not only is there Sunny and Janet, but we also have Christina and Plaxis. I'll invite you all to come onto camera, and we have the team, like I said before. So I'm actually going to hand it over to Christina and Plaxi to be able to moderate the questions. Me, Sunny, and Janet will be here as the primary physicians to answer questions, but we'll look forward to what else any of the team that has to participate.
Thank you, Dr. Leh and Dr. Oyama for presenting to us this evening. I did see one question here on the chat. Are e-notifications ever sent out to more than one physician if patients are on more than one panel? And I will invite Dr. Leh, Dr. Craig, and Dr. Oyama to maybe just answer that for us.
How about I'll hand it to Dr. Craig, because I saw she had replied to it in the chat.
Sure. Thanks, Chris. And I saw that there was a slide. So Kylie, it was on one of the slides that you showed, but the answer is yes. If a patient is on more than one physician's panel, then every paneled physician will get an e-notification. So another reason to work through your panel conflict reports and try and decide whose panel the patient belongs on. I don't think we really talked about the conflict reports and the also the demographic mismatch reports, but those are helpful in your practice as well. So the conflict reports will let you know if patients are on more than one panel, and then you can decide what you do from that point. There's no penalty for a patient to be on more than one physician's panel, but you have to decide if that's in the best interest for the patient to be on more than one physician's panel. And then there's also demographic mismatch reports where you can find out that you might have the incorrect name, or you might have the wrong birth date, and you can make corrections so that everything is accurate.
Thank you, Dr. Janet Craig.
I have a question. Could somebody comment on that relationship between Connect Care and Net Care? Is Connect Care going to take over and eliminate Net Care eventually?
Yeah, I can answer that. So at the moment, there are no plans for community family physicians to have Connect Care in their offices. So the community EMRs on the left side are not going away anytime soon. And so the plan is for Net Care to continue, and there's no plans for Net Care to be sunsetted at any time in the immediate future.
There's another one here. I'm on a TELUS EMR. Can I still sign up for CII and CPAR if I am changing EMRs? Should I wait?
So the best answer to that question is, how soon are you transitioning to another EMR? So if you're transitioning to another EMR, say in the next 6 months, so maybe in 2021, probably transition first and sign up second. But if you are not switching over to another EMR until 2022 or 2023, it's a good idea to sign up for CII CPAR right now. If you stay with a TELUS EMR, they have promised to seamlessly transition you from CII CPAR from one EMR to another.
There's another question that came up about PIAs. So if your clinic is unlikely that their PIA is not up to date, can you proceed with getting signed up with CII CPAR if the PIA is not quite ready?
You're on a roll, Janet. You should take
Yeah.
that one too.
I can take that one. I think it depends a bit how much of an overhaul the PIA needs. So if the PIA needs just a minor update, certainly you can go ahead with signing up with CII CPAR and get your minor updates going in the meantime. If you need a major overhaul, you might need to work on that first before you get going with CII CPAR. It is legally required to have an up-to-date PIA. So it is really important to update your PIA if it's not up to date. And it's not a good idea to wait till you switch EMRs if your PIA needs a major overhaul.
I did notice that Dr. Brooks had her hand up. I'm not sure if her question was answered. Dr. Brooks, did you still want to come off mute and ask your question?
So maybe while we're waiting, if Dr. Brooks or anyone else has any other questions, I'll maybe pass this to, or here's a question I'll just ask is, maybe I'll ask Dr. Craig first because she has a mature panel as well as, and she's been on this for a bit longer. How many notifications would you say you get in a day?
I can get anywhere from 0 to 3 per day. They've sort of looked, they usually quote an average of 1.3 to 1.7 per 1,000 patients in your panel typically per day. So it's not onerous. There's lots of days I get 0. There's some days I get 1 or 2. Occasionally I've gotten 3. Okay, this is I guess the latest. So 1.4 per provider per day, 11.2 e-notifications per week. And don't forget that not all those e-notifications you need to do anything about. You know, if you get an e-notification that your patient went to emergency to have a, you know, a sprained ankle and they had an x-ray and it's normal, you probably don't need to follow that up. But you might want to follow up, say, a diabetic that went into ER with, you know, diabetic ketoacidosis or something. Probably you'd want to follow that up. So not all e-notifications need follow-up.
And to be honest, one of the things that I found really nice is one of the tweaks that has been made recently is when people are admitted, and that was just a change. Before, the notifications only came when they were discharged, but it's also nice because it helps me have a conversation with my patients as they're like, oh, I'm going to be, you know, even this week, or sorry, last week, I had 2 people who went in to get deliveries or to deliver their babies. 2 people who had some planned elective procedures. So it was just nice for me to know that they were coming in. And then I had the chance to chat with their family, and then, I'll plan to see them as a discharge. So it's at least puts it on the radar that I really liked. And I think, because this reminds me of a question that someone was asking as they were feeling worried about, is this going to be extra onerous? I mean, we see the sheer numbers there, but I mean, ultimately, that's the type of information that we would get as a fax, that you're waiting for a unit clerk to send something to you and eventually gets to you. But it's nice to have something that's automated, that you're not just waiting for like a manpower sort of issue to happen, but there's something that gets automated that's related to their actual status with the hospital. So I think that's been really helpful for me as I'm trying to make sure I'm seeing, the timely patients that need to be seen.
And I'd just like to add a bit there. I'm still quite new in CII CPAR, but the e-notifications you get are actually not like very lengthy things for you to read, No, they kind of give you the information you need to know. When was the patient admitted? What was it for? So it's not going to take you off your normal schedule in that sense, So it's really nothing onerous at all.
We do have one more question here. In case of conflict, once the physician confirmed with the patient about attachment, how would that reflect? Do the 2 physicians need to talk to decide on which panel the patient belongs?
That's a great question, and I don't think there's a right or a wrong way to do it. One physician that we work with on our CII CPAR work, he received a letter from one physician saying, this patient is on my panel and on yours. This patient has made the choice to see me for all their medical care from now on. So could you please take them off your panel? And so that's one way to approach it, just a very polite letter. The doctor, Dr. Shute, he said he really appreciated getting that letter because now he can take that patient off his panel and he knows they're well looked after and he doesn't have to worry about them. I think every situation is going to be a bit different. I know I've also had the scenario where patients have moved away from the Edmonton area and still like to come see me once a year, once every 2 years for their pap smear and their, sort of annual physical exam, but they don't see me, for minor things. So I just have to accept that they're on 2 panels and their rural physician kind of knows that they see me as well. So we just accept that this patient is going to be on 2 panels for the moment.
And I just thank you so much, Kali, for the helpful slide that you've put up, because within the conflict report itself, it will actually say not only the last time they saw you, but the last time it was confirmed that they're on your panel. So that's part of kind of panel maintenance. And maybe just as a commentary on my end, because I'm still growing my panel, but I've done this for long enough where I'm trying to work on some of the processes. And so I'm really appreciative of the team at the PCN. And I guess what I would say is there's still a lot of pioneering work to do just to kind of figure out how things are going. There's nothing set in stone. Again, there's no penalty to say it's on two panels, but it's actually to clarify, all right, well, what is the role of this person's primary care? How are they viewing it? And so if we as family physicians value primary care, it's good to be able to have that conversation. Nothing is set in stone. And so there's best practices and ways to suggest it to the patients. And so that's still some of the work that I need to do to clarify and figure out the best way to do it.
Another thing I wanted to say about e-notifications is, Chris alluded to it, but your team can help you with those. So if you have a PCN nurse, maybe she can contact the patient post-discharge and find out to what happened and how they're doing and what care they need. So it's not all doctor work for sure. Think about who's on your team and who can help you out when you get those e-notifications.
And please feel free to type your questions if you still have any more questions to ask. Okay. Well, how to get started? There are some prerequisites that we have to meet, and they are quite simple and straightforward. The one is that the clinic must be live on Alberta Netcare portal. Most physicians are live on Netcare anyways, so that's not a big deal. And just assuming you are not, it's very easy to sign up to Netcare. It's super easy to do that. The second requirement is that you have to use a confirmed or compliant EMR system. And you can see the Health Quest is there, Akuro, Medasys, PS Suite, and Wolf. If you're using those, the last two, you have to upgrade to the latest versions to have the best possible results. And the third is that the clinic EMR privacy impact assessment, or we call PIA, must be up to date. Janet has talked about that already, and Chris mentioned that too. It's so easy, so very, very easy. I only had to do a minor update to mine, I think, because I was combining both clinics, but it wasn't anything at all. And Jason helped me through that. I didn't even need to do any, I probably just signed a page somewhere there. So it's very easy to do. And then finally, you must be panel ready. Most of us know what our panels are, and we know how to get, your panel numbers. If you have any difficulties, your PCN can help you figure this out and answer any questions and support you, with all you need, to sign up. Then reach out, to learn more. Now you can see from the slide there, each PCN has their physician rep as well as their CII CPAR contact. So you can see Chris is here, Janet is here. Thanks a lot, Janet, for joining us. And so contact your reps, contact your PCN, and you'll be surely guided on how to go about it. It's so easy. It's so super easy. I think I probably signed up. It didn't take more than 2 months to sign up, probably less than that. I'm not too sure, but it's really nothing, So please contact your PCN if you feel like this sounds like something good for you to do. Contact your PCN, and they will help you, through the steps. Are you a Health Quest user? I use Health Quest myself, and I just find that it's one of the easiest EMRs to use. And I've used lots. I used Wolf. I used some other one there, and before switching to Health Quest, And Edmonton Zone has the highest percentage of Health Quest users. The office is actually based in Edmonton, from what I understand. If you go to their website, you'll find stories there. There's a 26-minute video there by, Chris and Janet, which you can play. And there are lots of tools available at the Alberta Medical Association Act website as well. The next clinic manager sessions are coming up on June 16th, which is next week, and 24th, like 45-minute sessions there. It'd be a good idea for clinic managers who are present here, or who are interested in, for physicians who are interested in implementing CII CPAR in the clinics, to encourage them to attend. And when they attend those sessions, they'll basically know what CII CPAR is, the myths and misconceptions and all of that, how it works, how to get started rather, and how to use those reports once you've gone live. Like Janet mentioned, that they're able to assess those reports and bring them to your attention. Many PCNs have newsletters or communication channels where these meetings are advertised. I know in Sherwood Park, we have this advertised in our newsletter there, but overall, just feel free to reach out to your physician contact or the PCN, and somebody will certainly help you through the process. Once more, it's not anything difficult at all to do. There's going to be a survey after the presentation, which we sent to you, by email. We just didn't want to take too much of your time this evening, but We know most people are just back from work there. Chris has posted it, in the chat box there. So take some time, and it's a short survey, like probably not more than 5 minutes. Just take some time to complete that survey to help us. So I would like to, thank everybody, for attending this presentation, and I hope you got some bit of value for your time, just coming from work and all of that. So I would like to thank everybody who attended for, showing up. I would like to thank my co-presenters, Chris and Janet. You are rock stars. Thank you so much for thank you so much for helping out. And for other physicians, please feel free. If you need us to do another presentation at some stage, we are more than willing to do that. The whole idea is to share this message, answer questions. I was skeptical initially. I didn't hear about CII CPAR today. No, I've heard it for probably more than 2 years. But once I got to understand more about it, I signed up. And I can assure you, no regrets at all whatsoever. Thank you very much.
Thanks everyone for your time. We appreciate it. Have a good night.